Hi, welcome to my channel. Today our topic is tonsillitis. The tonsillitis is the inflammation of the pharyngeal tonsils. The inflammation usually extends to the adenoid and the lingual tonsils. Therefore, the term pharyngitis can also be used. Recurrent tonsillitis is defined as more than 7 episodes per year or 5 episodes in 2 consecutive years or 3 episodes for 3 consecutive years. The viruses are the most common etiology for tonsillitis. In around 50 to 30% of the cases, bacteria are isolated. Commonest bacteria are group A beta-hemolytic streptococci. Now let's see the clinical features. Fever, sore throat, foul-smelling breath, dysphagia, odonophagia, airway obstruction, lethargy and malaise, and tender cervical lymph nodes. The investigations. The investigations are not generally indicated in tonsillitis. However, in selected cases, full blood count, Epstein-Barr virus serology, and throat swab culture may be helpful. Now let's see the management of tonsillitis. Most of the cases diagnosed as tonsillitis does not require treating with antibiotics. Most of the cases are caused by viruses. Less than 30% of the cases are caused by bacteria. The mainstay of treatment is paracetamol for the pain management. There are complications associated with tonsillitis. Severe swellings of the tonsils can cause obstruction of the airway and cause stridor. Abscess formation is another complication. This infection can lead into the middle ear and cause acute otitis media. Peritonsillar abscess is a suppurative infection of the between the capsule of the palatine tonsil and the pharyngeal muscle. It is the most common abscess of the head and neck region. It is usually unilateral. It is a common complication of acute tonsillitis. The staphylococci, streptococci, and the anaerobes are the usual causative organisms. The children will present with swelling in the neck, pain, fever, drooling, dysphagia, trismus, and limited neck movements. The subsequent edema of the pharynx will cause inspiratory stridor. Clinical prediction score can be used to assist on the decision to prescribe antibiotics for tonsillitis. But this is not validated for children under 3 years, and this score can be used in recent onset pharyngitis less than 3 days of onset. It has 4 criteria, will receive 1 score for each criteria. The presence of tonsillar exudate, tender anterior cervical nodes, history of fever, absence of cough. The likelihood of bacterial infection increases with the increase of the score.